Yes, a very good evening to all the students who are viewing me. Uh, Today I am here in front of you to discuss the points, the various MCQs which are being frequently asked in various postgraduate examinations. We have got a number of very good number of questions here, and we will discuss the thorax first, and later the abdomen part. So now here, the first question what we see is the first sternocostal joint belong to the variety of symphysis, synchondrosis, syndesmosis, and plain synovial joint. So the first sternocostal joint, so that is a joint present in between the sternum and the first rib. So that joint is total ossification occurs. So there is no joint intervening in between the sternum and the first costal cartilage. Total fusion of the joint occurs. Now such a type of joint you call it as synchondrosis. Synchondrosis. So now what do you mean by a symphysis? Symphysis means it is a secondary cartilaginous joint. So actually we say the joints are of two types. So one is the movable joints and immovable joints. Movable joints you call them as synovial joints, as you know well, whereas immovable joints are called now these immovable joints, what you call it as synarthrosis, where two joints are being either combined either by means of a cartilage or by a fibrous tissue. So the joints are of two types, the fibrous joints and the cartilaginous joints. So the immovable joints or synchondrosis are of two types, the fibrous joints and the cartilaginous joints. The fibrous joints means the two bones are being connected by the fibrous tissue. Now they are of three types. For example, sutures, the two bones taking part in the formation of the skull, they are being formed by connected by means of a membrane, that is what you call it as a sutural ligament. So sutures are the examples for the fibrous joints. The second variety of fibrous joints is syndesmosis, where the two bones taking part in the formation of the joint are connected by the membrane, as you see in case of middle radioulnar joint. So that is what you call it as syndesmosis. Desma means band. The two bones are being connected by means of an interosseous membrane. For example, you find radioulnar joints, tibiofibular joints. Middle radioulnar joint, middle tibiofibular joint is the best example for syndesmosis. The third variety of joint is in between the tooth and the bone socket. That is what you call it as gomphosis. So finally, we understand that the fibrous joints are of three types. Sutures, where the two bones are connected by means of a sutural ligament. Syndesmosis, the two bones are being connected by means of a fibrous tissue or there is a membrane. Gomphosis. In all these three varieties of joints, fibrous joints, movement does not occur. The second group of joints are the cartilaginous joints. Here, the two bones are being connected by means of the cartilage intervening in between the two bones. And these two joints, these are of two types, the primary cartilaginous joints and secondary cartilaginous joints. The primary cartilaginous joints means the two bones are being connected by means of the cartilage. Intervening in between the two bones, you find the cartilage. As the age advances, gradually as the age advances, now this cartilage undergoes ossification. So total two bones, they totally fuse with one another. So you don't find a joint at all after some age of time. So such a variety of joint is called primary cartilaginous joint. This is also known as synchondrosis. So this is the best example what we have seen just now, the joint present in between the first costal cartilage and the sternum, that is the synchondrosis. The other variety of joint is secondary cartilaginous joint. So this is symphysis, where the two bones taking part in the formation of a joint are covered by means of hyaline cartilage, and that hyaline cartilage is being bridged by fibrous tissue. Here, the two bones, they totally do not fuse with one another. Joint persists throughout life. So symphysis, the best example we say symphysis pubis. In between the bodies of adjacent vertebrae, you find the intervertebral disc. That is the best example for symphysis. Symphysis minti, which is formed by the present in between the two halves of the mandible, though we call it as symphysis, it is a misnomer. For mandible, for all practical purposes, we treat it as a single bone. So now synchondrosis. So what is meant by synchondrosis is the two bones taking part in the formation of the joint are connected by a cartilage. As the age advances, that cartilage undergoes ossification and the two bones, they totally fuse with one another. So that is what you call it as a primary cartilaginous joint. Now all the primary cartilaginous joints, usually they will be present in the midline, particularly the joint present in between the manubrium sterni and the body of the sternum. So that is synchondrosis. Then between the body of the sternum and the xiphisternum. So that is a synchondrosis. So the various types of synchondrosis. The example is in a young bone we say there are three parts in the young bone: epiphysis, diaphysis. Then the epiphysis is connected to the diaphysis by means of a piece of hyaline cartilage. So junction between the epiphysis and diaphysis is one of the best example for a primary cartilaginous joint. So later also, as the bone grows older, as a complete growth occurs, epiphysis fuses totally with the diaphysis. So the question is, the first costochondral joint belongs to which variety of joint is? It is a synchondrosis. What about the rest of the costosternal joints, sternocostal joints? They are the synovial joints. You find 7 costal cartilages, they are articulating with the lateral border of the sternum. Except the first, rest of the 6 chondrosternal joints are the synovial joints. Now you can see the 8th costal cartilage is articulating with the 7th. So also 9th costal cartilage is articulating with the 8th. So these cartilaginous joints are also called synovial joints. Then, so the first sternocostal joints belong to the variety of synchondrosis or a primary cartilaginous joint. Primary cartilaginous joints, no movement occurs. For a secondary cartilaginous joint, what you have called it as symphysis, slightly movement may be possible. For example, symphysis pubis, during the time of the delivery, slight movement may be possible. So here you can see various examples for synchondrosis. Junction between the epiphysis and the diaphysis. Then in between the bodies of adjacent vertebrae, you find the intervertebral disc, and this one, manubriosternal joint, present in between the manubrium sterni and the body of the sternum. Then superior or supreme intercostal vein draining the first intercostal space drains into. So here we have to know the details of this azygous system of veins. So the posterior wall of the thorax is being drained by a specialized system of veins called azygous system of veins. So how this azygous system of veins are being formed, and what is the importance of these azygous? Azygous system of veins are the veins which are not accompanied by corresponding arteries. They are paravertebral in position, straight in course, and you don't find that valves are present. Valves are present in the azygous veins. Now, how this azygous vein is being formed? On the right side, lumbar veins, they join together to form ascending lumbar vein. Now, this ascending lumbar vein joins with the 11th or 12th vein, that is subcostal vein, to form azygous vein. So, azygous vein is formed by the union between ascending lumbar vein and the subcostal vein. And this azygous vein passes through the diaphragm, that is the aortic opening of the diaphragm. The vein is entering into the thoracic cavity through the aortic opening of the diaphragm. Then the vein passes upwards along the side of the bodies of the vertebra, and on reaching the 4th thoracic vertebra, the vein arches forwards and opens into superior vena cava. The vein is finally terminating by opening into the superior vena cava. So, azygous vein on the right side, it is being formed by the union of ascending lumbar vein and the subcostal vein. Then the vein is ascending up along the sides of the body of the vertebra, and then it is terminating into superior vena cava. Now, what are the various tributaries of this azygous vein? 11th vein, 10th, 9th, 8th, 7th, 6th, 5th. All these veins, posterior intercostal veins on the right side, they drain into the azygous vein. 2nd, 3rd, 4th, they join together to form right superior intercostal vein, which is draining into arch of azygous vein. First vein is draining directly into the brachiocephalic vein. So that is the way how this azygous vein or the posterior intercostal veins on the right side, they drain into the azygous vein. So azygous vein is being formed by the union between subcostal vein and ascending lumbar vein. How it is entering into the thoracic cavity? It is passing through the aortic opening of the diaphragm along with abdominal aorta and thoracic duct. The other two structures which are passing through aortic opening. Then the vein is ascending up. While it is passing up, it is receiving the 5th to 11th intercostal veins on the right side. 2nd, 3rd and 4th veins, they join together to form right superior intercostal vein. First one is draining directly into the right brachiocephalic vein. Now what about the story on the left side? On the left side, you find left subcostal vein joins with the ascending lumbar vein to form hemiazygous vein. So this hemiazygous vein runs upwards and it receives 11th, 10th, 9th, 8th and then drains into the azygous vein. Whereas on the left side, first drains directly into the left brachiocephalic vein, second, third and fourth, they join together to form left superior intercostal vein. Now this left superior intercostal vein is draining into the left brachiocephalic vein. Left superior intercostal vein drains into the left brachiocephalic vein. Whereas 5th to 7th, they join together to form accessory hemiazygous vein, which is draining into the azygous vein. Okay, so accessory hemiazygous vein is formed by the union of 5th, 6th and 7th posterior intercostal veins on the left side and it is draining into the azygous vein. Whereas 2nd, 3rd and 4th, they join together to form left superior intercostal vein which is draining directly into the left brachiocephalic vein. So left superior intercostal vein is draining into left brachiocephalic vein. Now the question here is superior intercostal vein draining the first intercostal space drains into. So on the left side it is draining into the brachiocephalic vein. Supreme means highest, first one, that is draining into the brachiocephalic vein. Whereas superior intercostal vein, the second one, 2nd, 3rd and 4th, they join on the right side into the azygous vein, on the left side into brachiocephalic vein. So the first intercostal space is drained by the highest or supreme intercostal vein, which is draining into the brachiocephalic vein on its own side. So the point here you have to remember is regarding the superior intercostal vein, that is supreme. This is superior intercostal vein. So superior intercostal vein on the right side into the azygous vein, on the left side into the left brachiocephalic vein. Then again the same thing, just now what we have discussed, the joint present in between the manubrium sterni and the body of the sternum. So upper part, sternum consists of three parts, manubrium sterni, body of the sternum and the xiphis sternum. So there is an angle between the manubrium sterni and the body of the sternum, that is what you call it as manubriosternal angle. And the joint is, so what type of joint it is? Symphysis. It is an example for synchondrosis. Primary cartilaginous joint, sorry, symphysis. Symphysis, it is example for symphysis. So now we have said previously syndesmosis. Syndesmosis means the two bones which are taking part in the formation of the joint are connected by interosseous membrane. The best example for syndesmosis is middle radioulnar joint and middle tibiofibular joints. Now what is synchondrosis? It is a primary cartilaginous joint where the two bones taking part in the formation of the joint are connected by a cartilage. As the age advances, it totally undergoes ossification. Now the manubriosternal joint, that is joint present in between the manubrium and body of the sternum, it is an example for synchondrosis, that is a primary cartilaginous joint. So later total fusion occurs. And the other point what you have to remember regarding this area is sternal angle. Sternal angle is the angle present in between the manubrium sterni and the body of the sternum. Now this rib which is corresponding with the sternal angle is the second rib. So this is a landmark for counting the ribs. So second rib, third rib, like that we can count, taking this manubriosternal joint as the landmark. And what are the various events which occur at the sternal angle of Lewis? The ascending aorta. The ascending aorta is continuing as arch of aorta at that level. The second point is arch continues as descending aorta at the level of sternal angle of Lewis. And this sternal angle of Lewis, if you trace it onto the posterior aspect, the imaginary line passes through the junction between T4 and T5. So posteriorly, the sternal angle of Lewis corresponds to the junction between T4 and T5. So at that level, various events which are occurring are ascending aorta continuing as arch continuing as descending aorta. At the level of T5, the thoracic duct takes a slight deviation onto the left side. So that also you can include it under one of the events which are taking place. Arch of aorta, the azygous vein arches over the root of the right lung at this level. So the joint present in between the manubrium and the body of the sternum in the median plane of the body allows limited movements, and it is a secondary cartilaginous joint, symphysis. The following is true regarding suprapleural membrane. Now, what is a suprapleural membrane? So, we know about the inlet of the thorax. The inlet of the thorax is being formed by the first thoracic vertebra, then you find the first rib, and then you find the manubrium sterni. So, those are the various boundaries of the inlet of the thorax. Then you find above the T1 vertebra, you find C7 vertebra. 7 vertebra is provided with a transverse process. Now, this apex of the lung projects above the inlet of the inner border of the first rib. So, the first rib will be like this. Posteriorly, you find T1 vertebra. Then the rib will be sloping downwards and forwards. Then you find the apex of the lung projecting slightly upwards. Now, this apex of the lung is separated from various structures present at the root of the neck by suprapleural membrane. The other name for the suprapleural membrane is Simpson's fascia. Now, it is a triangular membrane. Posteriorly, it is attached to transverse process of C7 vertebra, and anteriorly it is attached to inner border of the first rib. It is also known as Simpson's fascia or the suprapleural membrane. So, it has got the muscle fibers also, few muscle fibers will be present. Now, it is a dense facial layer also called Simpson's fascia, that is true. It is attached to the neck of the first rib. So, it is attached posteriorly to the transverse process of C7 vertebra. Then a cervical dome of pleura is attached to its undersurface. Now, apex of the lung is being covered by means of cervical pleura. Pleura is different, suprapleural membrane is different. Suprapleural membrane is a musculofacial membrane which is covering the apex of the lung. Apex of the lung is covered by cervical pleura. So, cervical dome of pleura is normally covering the apex of the lung, that is overlapped by the Simpson's fascia. It gives rigidity to the thoracic inlet and separates or prevents distortion of intrathoracic pressure during inspiration. Just now we have said the suprapleural membrane is separating the various structures present at the root of the neck from the apex of the lung. So, suprapleural membrane is a triangular membrane posteriorly attached to transverse process of C7 vertebra and anteriorly attached to the inner border of the first rib. So, here the wrong answer is it is attached to the neck of the first rib. It is attached to the inner border of the rib anteriorly, posteriorly to the transverse process. Okay. So, the other thing what you have to remember is alternate name. It is also called Simpson's fascia. So, suprapleural membrane is not attached, but it is related to the neck of the first rib. Related, that means it is crossing, across which you find the first thoracic nerve passing to take part in the formation of brachial plexus. Then, the following are true about arch of aorta. So, said just now we have said various events which are taking place at the level of sternal angle. Ascending aorta continues as arch at the level of second rib, then arch of the aorta continues as descending aorta at the level of the second rib. So, it starts from second right sternocostal joint. So, that is true. Then it arches over the anterior surface of trachea while ascending diagonally posteriorly. So, the arch of aorta, now you find a trachea like this, the arch of aorta will be present like that. So, it is present on the anterior aspect and then runs on the left side of the trachea and then passes down. So, it is present in front of the trachea and on the left side of the trachea and then passes down. Now, what is a bronchus which is present below the arch of aorta is left principal bronchus. So, it arches over the anterior surface of trachea, ascends diagonally posteriorly. It is a content of superior and posterior mediastinum. So, what is superior mediastinum? Superior mediastinum is a part of the mediastinum which is intervening in between the manubrium sterni. Now, this is the manubrium sterni. Then you find the body of the sternum, Xiphis sternum. Posteriorly, you find the vertebrae. So, from T1 to T12. Now, here if you pass an imaginary line anteriorly, it passes through the sternal angle of Lewis of T4, that is at the junction between T4 and T5. Now, this area is called superior mediastinum. Now, below you find the pericardium. This is a diaphragm. So, in front of pericardium you call it as anterior mediastinum, pericardium and the heart middle mediastinum, and then the posterior mediastinum. So, mediastinum can be divided by an imaginary line passing anteriorly through sternal angle of Lewis, posteriorly through lower border of T4 vertebra into two parts, superior mediastinum and inferior mediastinum. Inferior mediastinum can again be divided into three parts by pericardium: anterior, middle and posterior mediastinum. Now, ascending aorta is the content of middle mediastinum. Arch is a continuous present in the superior mediastinum. Descending aorta is the content of posterior mediastinum. So, ascending aorta continuing as arch at that level, arch is continuing as descending aorta at the same level. So, arch is totally a content of superior mediastinum. It is not a content of posterior mediastinum. What is the content of posterior mediastinum is descending aorta. Arch ascending aorta is present in the middle mediastinum. Then it is crossed anteriorly by left phrenic artery and left vagus. So that is true. If you take a cut section at the level of T4 vertebra, now you find arch of aorta like this. The arch of aorta on the lateral side, it is being crossed by left superior intercostal vein. Just now we have discussed left superior intercostal vein is being formed by the union of second, third and fourth posterior intercostal veins. Now that vein is draining into, what is the vein into which it is draining? It is draining into the brachiocephalic vein, into the left brachiocephalic vein. So before opening into the left brachiocephalic vein, it is crossing the left side of the aorta. Then you find the lung, left lung, and you find the left lung being covered by means of pleura. So the nerve which is crossing the arch of aorta close to the pleura is phrenic nerve. Then you find vagus nerve, left vagus, and cardiac nerves. So these are the nerves which are crossing the aorta on the left side. So anteriorly or anterolaterally, it is being crossed by four nerves: a pair of cardiac nerves or cardiac branches of left vagus, cardiac branches of left sympathetic, phrenic nerve and left vagus. On the medial side, you find two tubes, trachea. Behind that, you find the esophagus. In the groove between the trachea and the esophagus, there is recurrent laryngeal nerve. Slightly to the right side or left side, to the left margin of the esophagus, you find the thoracic duct. Thoracic duct. So these are the various structures which are related to the medial side of the arch of aorta. Then intervening in between the trachea and the arch of aorta, you find a plexus of nerves. Now this plexus of nerves is called deep cardiac plexus. So deep cardiac plexus, you find it on the right side of arch of aorta. So the structures which are crossing the arch of aorta on the left side are two main nerves. What you have to remember are left vagus, left phrenic, and cardiac branches of left vagus and sympathetic chain. Then on the right side, you find trachea, esophagus, left recurrent laryngeal nerve, deep cardiac plexus and the thoracic duct. That is very important. Thoracic duct that is present close to the left margin of the esophagus. Then where you find, what are the relations on the arch of aorta on the inferior aspect? So here we have said, what is the bronchus which comes in here? It is the left principal bronchus. Then you find the pulmonary trunk. Pulmonary trunk. Now what is the nerve which is crossing? We have said left vagus. Now this left vagus is giving off a branch called recurrent laryngeal nerve that is winding around the arch of aorta. So on the inferior aspect, you find left principal bronchus, left recurrent laryngeal nerve, pulmonary artery, and then superficial cardiac plexus. Superficial cardiac plexus is present on the inferior aspect. Deep cardiac plexus is present in between the trachea and the arch of aorta. Now there is an important branch which is connecting the arch of aorta and the left pulmonary artery in the intrauterine life. That is what you call it as ductus arteriosus. After birth, this ductus arteriosus is completely obliterated to form the ligamentum arteriosum. So on the inferior aspect, you find ligamentum arteriosum, left principal bronchus, left pulmonary artery, recurrent laryngeal nerve. On the left side, you find the phrenic nerve, left superior intercostal vein, left vagus, cardiac nerves, and on the right side, you find trachea, esophagus, thoracic duct, then the recurrent laryngeal nerve and deep cardiac plexus. So here it is not a content of superior and posterior mediastinum. So what is actually true is arch of aorta is totally a content of superior mediastinum. Then arch of aorta starts and ends at the level of fourth thoracic vertebra. Thus arch of aorta is wholly present in the superior mediastinum. Descending aorta is the content of posterior mediastinum and ascending aorta is the content of middle mediastinum. The following is the content of anterior mediastinum. Just now we have said, what is anterior mediastinum? It is the space intervening in between the pericardium and the sternum. What is the content of anterior mediastinum? Important, the lymphatic organ is present in the anterior mediastinum, that is thymus. Thymus. So here in the anterior mediastinum, we don't find much of the important contents in the anterior mediastinum. So if you take a section, this is the manubrium sterni, then you find the body of the sternum, xiphis sternum, then posteriorly you find the vertebrae. So here you find the pericardium. So this is now the space intervening in between the body of the sternum and the pericardium, you call it as anterior mediastinum. The content of the anterior mediastinum, you find sternopericardial ligaments. Sternopericardial ligaments. Apart from these sternopericardial ligaments, you find an important artery running on either side of the sternum, close to the lateral border of the sternum, that is branches of internal thoracic artery. Branches of internal thoracic artery. And an important organ which is present within the anterior mediastinum and the anterior part of superior mediastinum is thymus, lymphatic organ. Husserl's corpuscles will be, histologically you have to know about the Husserl's corpuscles. Thymus contains the Husserl's corpuscles. So that intervenes in between the anterior mediastinum and the sternum. As the age advances, the size of the thymus gradually it undergoes regression. So here the following is a content of anterior mediastinum. Now superior vena cava. Superior vena cava is not a content of anterior mediastinum. It is a content of superior mediastinum because right and left brachiocephalic veins they join to form superior vena cava. That directly drains into the right atrium. So heart is a content of middle mediastinum. Superior vena cava is a content of superior mediastinum. Left brachiocephalic vein. Left brachiocephalic vein and right brachiocephalic veins they are joining to form superior vena cava. So they are also the contents. Lower parts of brachiocephalic veins are the contents of superior mediastinum. Then pulmonary trunk. Pulmonary trunk is arising from the right ventricle and that divides into two pulmonary arteries. That is the content of middle mediastinum. Okay. So superior vena cava is the content of superior mediastinum. Left brachiocephalic vein, a content of superior mediastinum. Pulmonary trunk is the content of middle mediastinum. So the answer is thymus, the intervening in between the sternum and the so answer is C here. So anterior mediastinum is a space present in between the pericardium and the sternum. It is continuous through the superior mediastinum with the pretracheal space of the neck. Its principal content is thymus, which may lie, however, only in the anterior part of the superior mediastinum. So main content of anterior mediastinum is that. Then the following is true about transverse sinus of the pericardium. So sinuses of the pericardium. Pericardium is the covering of the heart. There are two layers which cover the heart. The covering of the heart you call it as pericardium. There are two coverings for the heart. One is the fibrous pericardium and the other is the serous pericardium. Fibrous pericardium is derived from septum transversum. So here you find the diaphragm. The fibrous pericardium will be totally fused with the diaphragm below. The central part of the diaphragm you call it as central tendon. Both the central tendon and the fibrous pericardium they are being developed from the septum transversum. So you cannot separate the fibrous pericardium from the central tendon of the diaphragm. Now if you trace it above, the fibrous pericardium is attached to roots of great vessels, that is to the ascending aorta and to the pulmonary trunk. So lower attachment of fibrous pericardium is to the diaphragm, upper attachment of fibrous pericardium is to the roots of great vessels. Then inside you find the serous pericardium. So there are two layers for the serous pericardium. Now this is the heart. At the level of the, now you find ascending aorta and the pulmonary trunk. Then there is superior vena cava, inferior vena cava, right pair of pulmonary veins, left pair of pulmonary veins. At the roots of these great vessels, there is a reflection between parietal layer and visceral layer. So here, now here you find two sinuses. One sinus is present in between the arterial end of the heart tube and the venous end of the heart tube. Venous end of the heart tube means superior vena cava, inferior vena. This is superior vena cava. In front you find ascending aorta and the pulmonary trunk. These are derived from the arterial end of the primitive heart tube. Now the space intervening in between the ascending aorta and the superior vena cava, this is what you call it as transverse sinus. Transverse sinus. The space intervening in between the ascending aorta and the pulmonary trunk anteriorly, posteriorly superior vena cava, below left atrium and above bifurcation of pulmonary trunk. That space is called transverse sinus. This sinus is being formed by the disappearance of mesopericardium. Then you find right pair of pulmonary veins and left pair of pulmonary veins. There is a sinus intervening in between these two pairs of pulmonary veins. This is called oblique sinus. So oblique sinus is a cul-de-sac, is a blind sac present on the posterior aspect of left atrium. So oblique sinus boundaries are on the right side, it is being bounded by right pair of pulmonary veins. On the left side bounded by left pair of pulmonary veins. Above reflection of parietal pericardium or serous pericardium, parietal part of serous pericardium or visceral pericardium. Anteriorly you find left atrium because you find the pairs of pulmonary veins, they open into the left atrium. So anteriorly oblique sinus is bounded by left atrium, below the space is open, right side by right pair of pulmonary veins, left side by left pair of pulmonary veins. Now what is transverse sinus? It is a sinus present in between the veins and the arteries. What are they? Ascending aorta and the pulmonary trunk. Pulmonary trunk bifurcates into right and left pulmonary arteries. So now this is a space. Anteriorly bounded by ascending aorta and pulmonary trunk, posteriorly by superior vena cava, upper margin of the left atrium. Below it is being bounded by left atrium. So left atrium is a chamber which is intervening in between the transverse sinus and the oblique sinus. So here the following is true about the transverse sinus of pericardium, except it is formed because of breaking of dorsal mesocardium between the arterial and venous end of the heart tube. Just now we have seen, if you take a half inflated balloon and if you push your hand like this, the heart is in the form of a tube initially. If you push your hand like this, one end of the tube is giving rise to ascending aorta and the pulmonary trunk, other end is giving rise to the veins. Now in between you find the dorsal mesocardium. The dorsal mesocardium is disappearing. That is responsible for the formation of the transverse sinus. It is being suspended. If you push your hand into a half inflated balloon, now you find two folds from which the hand is being suspended. That is what you call it as dorsal mesocardium. That is disappearing. As a result, transverse sinus is being formed. It is separated from the oblique sinus by a double fold of fibrous pericardium. There is no fibrous pericardium intervening in between the transverse sinus and oblique sinus. It is being separated just by means of upper margin of the left atrium. It is situated between the aorta and the pulmonary trunk in front, superior vena cava and left auricle appendage. Just now we have said, anteriorly transverse sinus is being bounded by ascending aorta and pulmonary trunk, posteriorly by the superior vena cava. So then pulmonary embolectomy can be performed through this space. So cardiac surgeries can be performed by ligating the great vessels by passing a thread through the transverse sinus. So here the following is true about it is separated from the oblique sinus by a double fold of fibrous pericardium. So fibrous pericardium is not intervening in between the transverse sinus and oblique sinus. These are the sinuses present within the serous pericardium only. So transverse sinus is separated. Now here you can see the picture where the oblique sinus and transverse sinus, how they are being separated. Oblique sinus, you remember, it is present behind the left atrium. Transverse sinus is present in between the arterial end of the tube and venous end of the tube. Then following grooves meet at the crux of the heart. So here you should know the detailed anatomy regarding the external features of the heart. So number of questions are being asked on the external features of the heart, which vein is present in which groove, which artery is present in which groove. So there are 4 chambers present within the heart. There are 4 chambers present within the heart. So right atrium is totally towards the right side. This is superior vena cava, right auricle, inferior vena cava. Now what I have drawn is right atrium. Then you find the right ventricle, left ventricle. From the right ventricle, the arising is pulmonary trunk. From the left ventricle, what is arising is arch of aorta. Now here, this is called apex of the heart. Apex of the heart is totally formed by left ventricle. Then, Base of the heart. Base of the heart is a fixed part of the heart. Now the base of the heart is not that which is resting on the diaphragm. Base of the heart is fixed part of the heart that is directed posteriorly. Most of the base of the heart, 2/3 of the base of the heart is formed by left atrium, 1/3 of the base of the heart is formed by right atrium. So base of the heart is fixed part of the heart that is directed posteriorly. 1/3 of the base is formed by right atrium, 2/3 of the base is formed by the left atrium. Then right border. Right border is extending from opening of superior vena cava to the opening of inferior vena cava. So entire right border is formed by right atrium. Then inferior border extends from the opening of inferior vena cava to the apex of the heart. So inferior border is formed by right ventricle and then the left ventricle. Left border extends from left auricle up to the apex. So now we have got clearly three borders. Right border from superior vena cava to the inferior vena cava totally by right atrium. Inferior vena cava to the apex, inferior border partly by the right ventricle and partly by the left ventricle. Left border extends from left auricle to the apex. Now what you are seeing surfaces. Between the right border, inferior border and left border, the surface what you are seeing is sternocostal surface. The surface which is resting on the diaphragm is diaphragmatic surface. Then already we have said the posterior surface or base both means same. Now in the sternocostal surface, the groove intervening in between the right atrium and the right ventricle is called right atrioventricular groove. Because it is present anteriorly, you can tell it as anterior part of right atrioventricular groove. Then between the right ventricle and left ventricle, anterior part of interventricular groove. Between the left auricle and the left ventricle, left atrioventricular groove. So here in the sternocostal surface you are able to see three grooves. Right atrioventricular groove, anterior part of interventricular groove, left atrioventricular groove. Now you trace these grooves onto the posterior aspect. If you go onto the diaphragmatic surface, this becomes the posterior part of atrioventricular groove. This is the anterior interventricular groove. Trace onto the back. I am drawing it in the dotted line. That represents the posterior part of interventricular groove. So posterior part of atrioventricular groove, posterior part of interventricular groove, they are meeting at a point. That meeting point is called crux of the heart. Then, so now major grooves we have seen. Left atrioventricular groove, right atrioventricular groove, these two are anterior parts. This dotted line is posterior part of atrioventricular groove. Then you find anterior part of interventricular groove, posterior part of interventricular groove. Now the heart is supplied by means of coronary arteries. There are a pair of coronary arteries. Right coronary artery, left coronary artery. Right coronary artery is arising from the ascending aorta. Then it is running in right atrioventricular groove, winding around the inferior border of the heart, enters into posterior part of atrioventricular groove, crossing the crux, and there it is terminating. The right atrioventricular groove, coronary artery arising, running in the right part of atrioventricular groove, winding around the inferior border of the heart and enters into the posterior part of atrioventricular groove. This is giving rise to branches. SCA nodal artery to the SCA node, atrial branches to the right atrium, ventricular branches to the right ventricle. Upper part of the right ventricle is being supplied by right conus artery, and one of the branch which is passing along the inferior border is right marginal artery. This is also called acute marginal artery. The right marginal artery which is arising from the right coronary artery is also called acute marginal artery. Then it is giving off posterior interventricular artery. Now what is the content of posterior interventricular groove is posterior interventricular artery. Then left coronary artery is arising from aorta. Then it is reaching the left atrioventricular groove, where it is terminating by dividing into circumflex branch and anterior interventricular branch. Anterior interventricular branch is running in interventricular groove, winding around the inferior border, enters into the posterior interventricular groove and terminates by anastomosing with posterior interventricular artery. Now what is the content of anterior interventricular groove, anterior interventricular branch? What is the content of left atrioventricular groove? Circumflex branch. That is winding round the left border, enters into the posterior part of atrioventricular groove and terminates by anastomosing with the right coronary artery. So, what are the contents of posterior part of atrioventricular groove? Terminal part of right coronary artery and circumflex artery. What are the contents of right atrioventricular groove? Right coronary artery. What is the content of left atrioventricular groove? Left circumflex artery. What is the content of posterior interventricular groove? Posterior interventricular branch and anterior interventricular branch. Then this left coronary artery is giving rise to ventricular branches. One is left conus artery and then ventricular branches to the right ventricle, ventricular branches to the left ventricle. The ventricular branch which is given to the left ventricle. So this is passing towards the apex of the heart. So this is called the left marginal artery. And another branch which is given by the circumflex branch which is passing along the left margin is called diagonal artery. Diagonal artery. Okay. So these are the various branches which are arising from the coronary arteries. Then the venous drainage. Venous drainage of the heart is mainly by coronary sinus. The large vein of the heart is called coronary sinus. The coronary sinus lies in posterior part of atrioventricular groove. Posterior part of atrioventricular groove contains coronary sinus. The various tributaries of coronary sinus are great cardiac vein running in anterior interventricular groove, then posterior interventricular groove and then terminating there. So what are the contents of anterior interventricular groove? Anterior interventricular branch and great cardiac vein. Then middle cardiac vein terminates into the coronary sinus. Now it is running in the, it is also beginning at the apex. It is running in the posterior part of interventricular groove. So middle cardiac vein is the content of posterior interventricular groove. Then small cardiac vein runs in the right atrioventricular groove and terminates into the coronary sinus. So three main veins: great cardiac vein running in the anterior interventricular groove, terminating into coronary sinus. Middle cardiac vein, posterior interventricular groove, terminating in coronary sinus. Small cardiac vein running in the right atrioventricular groove, terminating into coronary sinus. Finally, this coronary sinus opens into the interior of the right atrium. Apart from this, coronary sinus receives a vein from the left atrium. This is called oblique vein of left atrium, vein of Marshall, oblique vein of left atrium. Then a vein from the left ventricle. After receiving all these veins, it is terminating by opening into the interior of the right atrium. And this coronary sinus, opening of the coronary sinus is being guarded by a wall called Thibetian wall. Thibetian wall. So now, what are the contents of right atrioventricular groove? Right coronary artery, small cardiac vein. What are the contents of posterior interventricular groove? Middle cardiac vein, posterior interventricular branch, anterior interventricular branch. Contents of anterior interventricular groove, anterior interventricular branch, then great cardiac vein. Contents of posterior atrioventricular groove, coronary sinus, terminal part of right coronary artery and terminal part of circumflex branch. So here the following grooves meet at the crux of the heart except, so posterior interatrial groove, posterior atrioventricular groove, posterior interventricular groove, anterior interventricular groove. So here anterior interventricular groove is not at all meeting there. Anterior interventricular groove is present only on the sternocostal surface. So strictly what are meeting are posterior atrioventricular groove and then posterior interventricular groove. And there is a faint groove intervening in between the right atrium and left atrium. So you can tell posterior interatrial groove also. But which is not reaching that area is anterior interventricular groove. That is present only on the sternocostal surface. So answer is D. Then anterior interventricular groove is present on the sternocostal surface of the heart and does not reach up to the crux of the heart. It is situated on the cardiac base on the posterior surface. So here you can see the right atrium, you can see clearly the anterior interventricular groove and then the right atrioventricular groove. Then following are the branches of right coronary artery except following are the branches of right coronary artery except. Now here you can see the right coronary artery already I have said it is arising from the anterior aortic sinus, then running in the right atrioventricular groove and terminating on reaching the crux of the heart. It is giving rise to SCA nodal artery. In 70% of the cases, SCA nodal artery arises from right coronary artery. Atrial rami, ventricular rami. Then one of the ventricular ramus is very large and reaches the apex of the heart. That is called marginal artery. Then it is giving rise to posterior interventricular branch. So posterior interventricular branch is a branch arising from right coronary artery. Anterior interventricular branch is arising from left coronary artery. Here we have to understand what is coronary dominance. If the posterior interventricular branch arises from right coronary artery, then it is called right coronary dominance. If it is arising from left coronary artery, that is circumflex branch, then you call it as left coronary dominance. Now here we try to understand that interventricular septum. Between the two ventricles there is a septum called interventricular septum. Along the anterior aspect of interventricular septum, you find and in the anterior interventricular groove, you find anterior interventricular branch that is winding around the base and then going on to the posterior aspect. In the posterior aspect of that is interventricular groove, you find the posterior coronary artery. Both of them are anastomosing with one another. Now in this interventricular septum, you find bundle branch, bundle of His, an important conducting tissue. So this interventricular septum blood supply is important. Anterosuperior part of the interventricular septum is supplied by means of anterior interventricular branch. Postero-inferior part of the interventricular septum is supplied by posterior interventricular branch. So postero-inferior part contains the bundle of His and that it is running in the bundle of His. If this posterior interventricular branch arises from circumflex artery, then the entire interventricular septum will be under the control of left coronary artery. That is what you call it as left coronary dominance. If the posterior so that is dangerous. If this left coronary artery is totally blocked, then the entire interventricular septum is affected. If the posterior interventricular branch is arising from terminal part of right coronary artery, then you call it as right coronary dominance. If it is arising from both right coronary artery and from circumflex artery, then you call it as balanced type. So depending on whether the posterior interventricular artery is arising from right coronary artery or from the circumflex branch, we can describe the cardiac dominance. Right coronary dominance, left coronary dominance and balanced type. So here the following are the branches of right coronary artery except SCA nodal artery, AV nodal artery, marginal artery, circumflex artery. Circumflex artery is a branch arising directly from the left coronary artery. So left coronary artery branches are anterior interventricular branch and the circumflex branch. Marginal artery, of course, it arises from both. Right marginal artery is arising from right coronary artery, left marginal artery is arising from the left coronary artery. Then circumflex branch is arising from left coronary artery, curving to the left in the posterior atrioventricular sulcus. It gives off various ventricular branches to anastomose with the terminal part of right coronary artery. So circumflex artery is terminating by anastomosing with the terminal part of right coronary artery. The important branch given by circumflex artery, which is passing along the left margin, is diagonal artery. Then the following are the veins draining directly into the right atrial chamber except. So just now we have seen various veins which are draining into coronary sinus. What is coronary sinus is the vein, a large vein which is draining directly into the right atrium, A large vein, coronary sinus, which is roughly about 2 centimeters in length. It is situated in the posterior part of atrioventricular groove. And this vein is opening into the right atrium. That opening is guarded by a valve. That is what you call it as Tibacean valve. And the opening of coronary sinus is present in between the opening of inferior vena cava and right atrioventricular orifice. Now, what are the main tributaries of this great coronary sinus? It is receiving great cardiac vein, which is present in the anterior interventricular groove. It is receiving middle cardiac vein, which is present in the posterior interventricular groove. And it is receiving small cardiac vein, which is present in the anterior atrioventricular groove. So, apart from these three veins, it is also receiving vein of left atrium, that is called vein of Marshall, oblique vein of left atrium, vein of Marshall, and then posterior vein of left ventricle. So, these are the various tributaries which are draining into the coronary sinus. After these tributaries drain into coronary sinus, then the coronary sinus is opening into the interior of the right atrium. So 70% of venous blood is drained into the interior of the right atrium through the coronary sinus. What about the 30% of the blood? 30% of the blood, some of the anterior cardiac veins, they open directly into the interior of the right atrium. So if you open the interior of the right atrium, you find small opening, foramina. Those foramina are the veins which are draining directly. Those you call them as anterior cardiac veins. Now, venae cordis minimi, these are the veins which are draining directly the venous blood into respective chambers. Even into the right ventricle, into the left ventricle, various veins they directly open into that chamber. Those are called venae cordis minimi. So, the following veins drain directly into the right atrial chamber except, so middle cardiac vein, it is draining into the sinus venosus, coronary sinus. Then you find anterior cardiac vein, it is draining directly into the right atrium. Small cardiac vein, occasionally it drains directly into the interior of right atrium, venae cordis minimi. So, here the answer is A. So, middle cardiac vein never drains directly into the, sometimes this small cardiac vein drains into the interior of the right atrium, but usually it drains into the coronary sinus, but sometimes it may drain directly into the interior of the right atrium. Middle cardiac vein always drains directly into the coronary sinus. So, middle cardiac vein does not open directly into the right atrial chamber. It accompanies the posterior interventricular groove and opens into the coronary sinus near its termination. So, finally remember what are the various tributaries of the coronary sinus. Coronary sinus is present in the posterior part of atrioventricular groove. The various tributaries are great cardiac vein, middle cardiac vein, small cardiac vein. Oblique vein of left atrium called vein of Marshall, posterior vein of left ventricle. 70% of venous blood is drained into the right atrium through this vein. Rest of the veins, the 30% is drained directly into the right atrium through anterior cardiac veins. Occasionally, the small cardiac vein may drain directly into the interior of the right atrium. Then, line of pleural reflection crosses mid-axillary line at that level. So, here we know the lung is being covered by means of pleura, but the limits of the lung exactly does not correspond with the limits of the pleural reflection. So, if you see the various limits of the lung, now we take it in relation to mid-clavicular line. Pass a line midway between the medial end of the clavicle and lateral end of the clavicle. Mid-axillary line between the anterior axillary folds and posterior axillary folds. Then posteriorly scapular line. So, here I am representing three lines. Mid-clavicular line, mid-axillary line and scapular line. So, here we get a view from the side of the thoracic wall. Take a point on the 6th rib in the mid-clavicular line. Take a point on 8th rib in the mid-axillary line. Take a point on 10th rib in the scapular line. You join all the three. That represents the lower limit of lung. So, lower limit of the lung is 6th, 8th and 10th ribs on the mid-clavicular, mid-axillary and scapular lines respectively. Take a point on two ribs difference. Take a point on 8th rib in the mid-clavicular line, a 10th rib on the mid-axillary line, 12th rib on the scapular line. Join the three. That represents the lower limit of pleura. Now, the two ribs, the two rib space intervening in between the lower limit of the lung and lower limit of the pleura, that is what you call it as pleural recess, costodiaphragmatic recess. So, here the line of pleural reflection crosses mid-axillary line at what level? So, it is the 10th rib, 12th rib in the scapular line, 8th rib in the mid-clavicular line. Lower limit of the lung is different, lower limit of parietal pleura is different. The two rib space intervening where you do not find the lower margin of the lung, where you find the costal pleura coming in direct contact with the parietal, that is diaphragmatic pleura. That recess you call it as costodiaphragmatic recess.